Feeling better is one thing, but being ready to run, lift, and return to full activity is another. In this episode of Full Strength Spotlight, Dr. Kaitlyn Ronaghan explains what comes next. When an active adult only feels pain during higher level activity, but seems fine during everyday movement, how do you identify what is actually limiting them?
So we want to make sure that we're actually loading up into that dynamic activity, whether they have knee pain with squatting 150 pounds or ankle pain or knee pain with running 2 miles. So we want to see them in that activity that causes pain. So we want to make sure that we're loading them and then taking a look at the mechanics with how they're doing that, making sure A, if there's anything that we can tweak during the movement that can help decrease pain, or B, seeing what impairments that they have, that way we can focus on those while we're in PT.
When someone keeps spraining an ankle or experiencing recurring knee pain, what might be missed if they focus only on the injured joint?
So when someone keeps having a recurrent knee pain or ankle pain, we want to make sure that we're looking above and below the joint that's in question. So making sure if they're having knee pain, seeing what strength they have in the hips, seeing the hip stability, making sure that the ankle stability is good. So we want to make sure there's no other contributing factors to that pain, so that way we can tweak it if there is something kind of high or below the joint.
How do you help a runner increase mileage again after an injury without doing too much too quickly?
So we want to make sure that we're monitoring them very well. So making sure in the beginning, doing like intervals is going to be key. So making sure doing like 30 seconds on and then maybe a minute off, and then going to work up to a minute on to a minute off, and kind of progressing that way, either progressing how long they're running or kind of the duration of the run. And then checking in on symptoms. Is there any increased pain during, before, after the run? Any soreness during, before, after the run? And seeing how long those symptoms last. And then modifying if they last a little bit longer than they should, kind of taking it back to a little bit less, seeing how they progress there, and then bumping them up basing on how their symptoms progress.
After ankle, knee, or hip surgery, what functional milestones matter before someone returns to running, cutting, or changing direction?
Before functional movements, we want to make sure that we're looking at some functional tests, whether that be limb symmetry, making sure they're around 90% symmetrical side to side. We can take a look at quad and hamstring symmetry as well. And then we also want to look at some dynamic movement stuff. So doing single leg hop tests, doing triple single leg hop tests, and seeing kind of what impairments they have there, making sure there's no pain, and then kind of progressing to more of those dynamic cutting motions.
What is one mistake active adults commonly make when they start feeling better but are not fully ready to return to their usual activities?
When pain decreases, a lot of times we see patients want to return to the activities that they were doing before. So whether they be kind of loading up too much, going right back into what they were doing before, which caused the injury. So making sure that we're modifying things as needed. So even if there's no pain, they might still have those impairments in strength and stability. So making sure we're educating them, letting them know, hey, even though you're feeling better, we want to continue to work on these impairments that you have. So making sure we're able to modify things depending on how they're feeling and kind of gradually load them up, so that way they're not doing too much too fast.
What is one message you would leave with someone who feels frustrated by an injury?
One message that I would leave for someone who feels frustrated is to not take it to heart. So knowing that progress isn't always linear. So there's going to be ups and downs with progress, but as long as we're kind of trending upwards, that's going to be main key. There's going to be some days that aren't going to be as good as others, but making sure you're looking more on the positive side, you're doing PT, you're doing all the right things, you're strengthening up, making sure that you're looking more on the positive side than the negative side.